So one of the studies that was sort of a buzz at the ADA, the meeting, was the REWIND study. And in this study, it was interesting because they had both secondary prevention patients and primary, a large chunk of primary prevention. So they didn't have a heart attack or stroke or cardiovascular event yet, so around 70% of them. And that study was 9,901 patients. And the median follow-up for a GLP-1 study, this one is long, so it's 5.4 years. I think it's the longest one. And so basically, it was dulaglutide once a week versus usual care. So that was the study design. So David, can I have you go over what the results were? Because everybody was talking about this, this particular study.
Well, certainly. This was almost like the talk of town to understand what the REWIND data showed, especially with the top-line results that were announced much earlier on. As Peter alluded to, there were more than 9,900 people enrolled in this study and divided equally among placebo versus active treatment with, with dulaglutide, 1.5 milligram subcutaneously once a week. So after a median follow-up of about 5.4 years, there was a statistically significant 18% reduction in the 3-point MACE, or major adverse cardiovascular events, namely, again, non-fatal MI, non-fatal stroke, or cardiovascular mortality. What was also very interesting was the fact that in terms of the pre-specified subgroup analysis, there was absolutely no difference in terms of the duration of diabetes, gender, baseline A1C, and so on. In other words, the benefit of 12% relative risk reduction was seen in both the primary cohort as well as in the secondary prevention cohort. And once again, there was no difference with respect to gender, baseline A1C, duration of diabetes, whether or not they have prior cardiovascular disease. So the results were actually very consistent. Again, bearing in mind that these are individuals, about 2/3 of them were considered as primary prevention. In other words, they do not have evidence of cardiovascular disease, but multiple risk factors present, as opposed to the other third with established cardiovascular disease.